More than 200 scientists from around the world are now pressing the WHO to take another look at its guidelines when it comes to the way COVID-19 is spread. In their open letter published a short while ago, the researchers say there is emerging evidence that the virus could be airborne. Currently, the WHO says the coronavirus is transmitted between people through respiratory droplets and contact. Well, Lindsay Marr is an expert in airborne transmission of viruses at Virginia Tech, also a co-signatory of that letter. She says the WHO is underplaying the risk of airborne spread. So Professor Marr, she joins us right now in San Francisco. Thank you for joining us today.
Thank you for having me, Michael.
Listen, explain to our audience in the most lay terms as possible, how do your findings differ from what we're hearing from the WHO?
The World Health Organization has said that transmission by aerosols, which are microscopic droplets smaller than we can see, only happens in healthcare settings, in hospitals, when certain procedures are being done, such as intubation. But we know that activities like just talking and breathing also generate such microscopic droplets. We know that they can contain virus if the person is infected, because the virus has been found in the air in hospitals in these very small microscopic droplets. We also know that the virus can survive in those aerosols or microscopic droplets. And there have been these big super spreading events like the choir outbreak and at a restaurant, where really the best explanation is aerosols, inhalation of aerosols for transmission.
So how would this understanding of the virus and its spread affect current protocols? What would people have to do differently, essentially, to protect themselves from COVID-19, given what you're finding?
People just need to place more emphasis on some of the things we're already doing in many places, such as social distancing and mask wearing, and paying attention to ventilation of buildings and making sure we're using as much outdoor air as possible, avoiding crowded spaces and avoiding recirculated air. And if possible, moving activities outdoors where there's much greater opportunity for dilution of these aerosols than indoors, where they can become trapped and build up.
Now, you've been very vocal on this issue for some time now, calling for more attention, if you will, on airborne transmission. So are there any dangers to ignoring your finding?
I think the risk of ignoring airborne transmission is that the disease will continue spreading rapidly, as we've seen, but there are simple measures that we can take to help slow this down. And we've seen this in some countries, for example, where there is widespread wearing of face coverings, which has been helpful, in addition to distancing, the other things I mentioned, and good testing and contact tracing.
Well, let me just quickly add a question about distancing, though, because with this airborne transmission, we keep talking about this 2 meter or 6 feet measure of physical distancing, social distancing. Does your finding suggest that the airborne component actually goes beyond those parameters, that perimeter?
Yes, that 6 feet rule, or 2 meters, whatever distance you choose, is not a magical distance beyond which everything is safe. It describes how far large droplets can travel if someone's talking. These are large ones that fly through the air and would land directly on your body. But the smaller ones can easily travel farther than that. But the distancing still helps with aerosol transmission, because if someone is infected, those aerosols are going to be most concentrated close to them. Kind of like if a person is smoking, the cigarette smoke plume is most concentrated or dense near that person. And as you get farther away, it becomes more diluted, and the chance for exposure or breathing that in is lower. Of course, this changes if you're in a small indoor environment that doesn't have good ventilation, where things can build up. But the distancing helps with droplets, it helps with aerosols.
Okay, well, listen, to my understanding, currently the WHO does acknowledge a theoretical risk of what you're talking about, but also says there's not enough evidence to make a hard conclusion. What do you say to that?
I would say that there's not the type of hard evidence that they want for any particular route of transmission, whether it's touching contaminated objects or the idea of large droplet spray. We don't know. It seems clear that all of these routes could be happening, and given the scale of the pandemic, I think it's wise for us to do as much as we can to slow down or interrupt all of these different routes.
Now, throughout this pandemic, the WHO, as you know, has faced a lot of scrutiny. And in fact, you say that the World Health Organization is relying on a dated definition of airborne transmission. What do you mean by that?
Some of their guidance and the way they define aerosol transmission is based on studies from the 1930s, 1940s, and 1950s, when we did not have the instrumentation, the ability to to detect the aerosols that we're talking about. That said, even so, those studies back then did suggest that air transmission by aerosols could be happening. I think there's been some misinterpretation of those older studies in developing the WHO's guidance.
Well, Professor Lindsay Marr, thank you for this. We'll be watching developments very closely. Appreciate your time.
Great, thank you very much.
And Lindsay Marr is an expert in airborne transmission of viruses at Virginia Tech.